psilocybin and microdosing. Unlocking the potential of a natural compound with MamaDose. Psilocybin. Psilocybin is a fascinating psychoactive compound found in certain species of mushrooms. When consumed, it initiates a spectrum of effects that not only impact the physical brain but also profoundly influence the psychological mind. Upon ingestion, psilocybin is metabolized into psilocin, which primarily interacts with the serotonin receptors in the brain, specifically the 5-HT2A subtype of serotonin receptors. Serotonin is a neurotransmitter that plays a pivotal role in regulating mood, emotions, and perception, and the 5-HT2A receptor is believed to be a key player in the psychedelic effects triggered by psilocybin. Microdosing with psilocybin. Microdosing with psilocybin is a practice gaining traction in recent years. It entails consuming small amounts of psilocybin that fall below the threshold required to induce full-fledged psychedelic experiences. While the specific dosage varies from person to person and depends on the potency of the mushrooms or other sources, a typical microdose ranges between 0.1 to 0.5 grams of dried psilocybin-containing mushrooms. Crucially, a microdose is described as subperceptual, which implies that those partaking in microdosing should not anticipate significant psychedelic effects like visual hallucinations or a distorted perception of reality. Instead, the aim of microdosing is to attain subtle enhancements in mood, creativity, focus, and productivity, all while maintaining the ability to engage in daily activities without substantial side effects. Benefits of microdosing psilocybin. Microdosing psilocybin has captured the interest of researchers, particularly in the realm of mental health. Some reported advantages of microdosing include: 1. Treatment of depression and anxiety. Emerging studies suggest that psilocybin may be effective in mitigating symptoms of depression and anxiety, with prolonged benefits observed even after just a single dose. 2. Treatment of addiction. There is promising evidence indicating that psilocybin could be beneficial in addressing addiction issues, particularly concerning substances such as tobacco or alcohol. 3. Enhanced quality of life in cancer patients. Psilocybin may help enhance the quality of life for cancer patients by reducing anxiety and depression associated with their diagnosis and treatment. 4. Increased creativity and openness. Some individuals report that psilocybin can foster heightened creativity and a greater openness to novel ideas and experiences. Risks of microdosing psilocybin. Although microdosing is generally considered a safer alternative to higher doses of psilocybin, it is not without potential risks and drawbacks. These include: 1. Psychological distress. Psilocybin can induce feelings of anxiety, paranoia, or confusion, especially in individuals with a predisposition to mental health conditions. 2. Physical side effects. Users may experience physical symptoms like nausea, vomiting, diarrhea, and increased heart rate and dilated pupils. 3. Risk of triggering or exacerbating mental health conditions. Psilocybin use can potentially trigger or worsen underlying mental health conditions, especially in individuals with a history of such issues. 4. Interactions with medications. Psilocybin can interact with certain medications, including antidepressants, anti-anxiety drugs, and MAOIs, potentially leading to adverse side effects such as serotonin syndrome or high blood pressure. Microdosing protocols. Microdosing is typically conducted following specific protocols popularized within the microdosing community. These protocols offer guidance on selecting the appropriate dose and frequency. Common microdosing protocols include the Stamets stack, which involves a specific combination of substances and regular dosing every 2 or 3 days. The key is to commence with a low dose and adjust it as needed based on individual sensitivity. How to microdose. Commencing a microdosing regimen with psilocybin involves several key steps. 1. Set intentions and goals. Clearly define the reasons for microdosing and establish clear intentions and goals, facilitating a focused approach to desired outcomes. 2. Choose a starting dose. Initiate with a low dose, typically around 1/10 to 1/20th of a typical recreational dose. Starting conservatively is advisable, with adjustments made if necessary. 3. Select a dosing frequency. Decide on a dosing frequency aligning with personal preferences and lifestyle, whether it's every 2 or 3 days or another schedule. Consistency in dosing is paramount. 4. Stay consistent. Consistency forms the bedrock of successful microdosing. Cultivate a routine around your microdosing practice and meticulously track progress and experiences. Establishing the right setting is also crucial for any psychedelic experience, including microdosing. The set and setting principle underscores the importance of the physical and psychological environment. Elements to consider when creating the right setting include ensuring a welcoming, tidy, and tranquil physical environment and fashioning a personal space to foster a centered mindset. It's crucial to note that psilocybin can interact with certain medications, necessitating consultation with a healthcare provider before engaging in microdosing, particularly for individuals using medications. Interactions can result in adverse side effects, and the effects of psilocybin may be attenuated in individuals on specific psychiatric medications like SSRIs and MAOIs. Recent clinical studies. A study published in the Journal of Psychopharmacology in 2020 discovered that microdosing psilocybin correlated with enhancements in mood, creativity, and mindfulness among a sample of 98 participants. The study also highlighted the safety and tolerability of microdosing. 1. Another study published in the journal ACS Pharmacology and Translational Science in 2021 found that microdosing psilocybin was linked to improved mood and cognition in a sample of 48 participants. The study reinforced the safety and tolerability of microdosing. 2. Ongoing clinical trials are actively investigating the therapeutic potential of psilocybin, encompassing its potential in treating conditions such as depression, anxiety, PTSD, and addiction. 3. Research is also delving into the long-term consequences of psilocybin use and various therapeutic frameworks for its administration, including guided imagery and music. 4. Legalization initiatives in diverse regions worldwide are paving the way for more comprehensive research into the therapeutic potential of psilocybin. In conclusion, microdosing psilocybin stands as a promising therapeutic tool, albeit one that should be approached with caution, ideally under professional guidance within a legal and secure environment. An understanding of both its potential benefits and risks is imperative for individuals contemplating microdosing with psilocybin, and consultation with a healthcare provider is advisable, especially for those on medications. As ongoing research unravels the potential of psilocybin, microdosing remains an exciting frontier in the exploration of the mind and its capacity for healing and personal growth. Follow Mama Dose and the plant medicine path for all you mental clarity information and education.